Okay, let's look at some of the issues in insurance markets in the Bismarckian model. So first of all, they have very managed competition, like heavily regulated competition with four big rules. One is that they have to meet minimum standards for coverage. So they have to, cover essential needs, and there's some limits on copays and deductibles. They have open enrollment, meaning that everyone has to be allowed to get coverage when they want to, and also compulsory participation, so everybody has to get coverage somewhere. And then finally, community rating. Insurers cannot vary premiums based on your health. So, because they have to accept everybody, there is some incentive for insurers not to get the sickest patient, so they don't end up having to spend all their money on healthcare. So risk selection is something that occurs when insurers seek to enroll the low risk consumers and avoid the high risk consumers. This is different from adverse selection. Adverse selection is when the insurance consumer who is sicker decides they want like more generous coverage. Risk selection is something that insurance companies do, and it's when they're trying not to have sick people on their plan. There's some different kinds of tactics. I mean, it's mostly outlawed by most governments, and yet there are some kind of under the radar tactics that insurance companies can employ for risk selection, like just choosing where they're going to advertise and who they're going to advertise to. So if you'll notice, before I used to notice on the subway that these like private insurance Medicare plans would have really healthy seniors in their commercials. Like they would be jogging, like doing the jump roping and stuff in there because they're trying to advertise to a select group of seniors. They can close offices in high-cost regions. They can do things like holding an enrollment session in a building that's not accessible to disabled persons. So, health insurance info session in a fifth floor walk-up, something like that. So it's kind of not illegal, but there are tactics that insurance companies are using to engage in risk selection. This is a cartoon of that, It's real easy to sign up, just follow the flames. Dante's health insurance open enrollment. Technically, it is open enrollment. So there are some ways to eliminate risk selection. One is after the fact, so that different insurance pools have to reimburse one another. If one of them ended up having way sicker customers than the other, then the one that had all of the healthy people has to reimburse the one that had all of the sick people, and that kind of evens out the underlying risk, but it also removes any incentive to treat patients efficiently, especially if it's based on cost. So if one insurance company just ends up spending a lot of money on their patients, they're going to get reimbursed for that anyway, so there's no incentive to be efficient. Another one is to reimburse not based on how much you ended up spending, but instead based on the risk. So this is ex ante, before it happens, reimbursing one another based on the health of the customers and not based on the amount that the customers spent. So it reduces the incentive for risk selection, but still maintains some incentives for efficiently treating patients. But it also actually still keeps in place some of the incentive to engage in risk selection, at least risk selection that's not being picked up by whatever they're using to make people pay each other back. So in the Bismarckian model, in addition to risk selection, we also have some adverse selection. In the beverage nations, everybody's automatically in the same single national pool, so there is no adverse selection and there is no risk selection either. In the Bismarckian nations, we still have managed insurance competition. Because there is a mandate, some of the worst of the adverse selection is prevented because the healthy people are going to continue to pay into that system and continue to subsidize the sick. They're paying into at least some pool. But we still might have some adverse selection if the sicker customers end up enrolling in those insurance plans that have the most generous coverage. It can become extremely destabilizing if the firms are not allowed to adjust their premiums, as is the case in Israel. No matter how expensive that pool is, they can't change premiums or even not just how expensive the pool is, but also how generous the coverage is. So they really have no incentive to provide quality care for their sicker consumers. Because either way, they're going to get paid the exact same amount. So there are two ways of addressing adverse selection in Bismarckian systems. One is that there is no choice of insurers. Like in Japan, you have your coverage either through your employer or through the same national pool. Or you can restrict the degree to which these insurance plans are really different from one another. So if one of them is not that much more generous than the other, there's going to be little in terms of like coverage generosity that's going to attract sicker customers to one pool over another. So it reduces inequality between the two insurance pools as well. This is what they do in Germany.